Good evening. I'm Len Brzezis. I'm Executive Director of the Association of Healthcare Journalists. And on behalf of the board, staff, and local committee of AHCJ, I'm pleased to welcome you to Health Journalism 2012, our 13th annual conference. We're pleased to bring this conference back to Atlanta this year, the first time in 11 years. I want to thank our local hosts, Emory University, Children's Healthcare of Atlanta, and the University of Georgia, our endowing sponsors, the Helmsley Charitable Trust and the Robert Wood Johnson Foundation, and our many general conference sponsors who you will find listed in your program. Their support helps us put together a first-class conference, some of them supporting fellowships which helped many of you get here. We're especially thankful to you who are attending this year. It's reassuring that so many of you see the value in this kind of professional development. The short video you just watched serves as a great introduction to our special guests this evening. We are honored to have with us today former President Jimmy Carter and former First Lady Rosalynn Carter. They served together in the White House from 1977 to 1981. And while we may have an image of former White House occupants heading for the golf course and some well-earned rest after leaving office, our guests tonight have been anything but leisurely with their years since leaving Washington. If anything, they have broadened their service in those 30 years, and each with a special individual interest in health and well-being. That's what we've asked them to share with us tonight. Our interviewer this evening is Andrew Holtz, whom many of you know as a former longtime board member. He is a freelance writer and author in Portland, Oregon, and a former CNN broadcaster right here in Atlanta. I ask you to welcome President and Mrs. Carter.
And let me welcome all of you, and especially welcome you, President Carter, Mrs. Carter. Thank you very much for joining us. I'd like to start for each of you to give you an opportunity to tell us what's new with you. So first, President Carter, what's going on?
Well, to stick with healthcare, which is always a great pleasure for me, let me remind the audience that the Carter Center has a very large budget of about $100 million a year. But 85% of it is spent on healthcare, dealing with 6 diseases. And we are getting to the end of one of the diseases now, as you have heard all about with guinea worm. And this disease is a horrible disease. You may have, those of you who study the Bible, I'm sure that includes everyone here. It was known as the fiery serpent in dealing with the Israelites as they left Egypt. And it also is a symbol for the medical profession. You've seen the symbol with the staff with 2 things wrapped around it. Those are guinea worms. They're not snakes. And that was the only way you could treat guinea worms when we first started working on them, was to, with the medical men and so forth, would wrap the guinea worm around a stick to expedite its emergence from the human body. Ordinarily it takes about 30 days, which is excruciatingly painful. And if you wrapped it around a stick and put some tension on it, you could get the guinea worm out in 20 days, so that was the only treatment for it. Well, I'll just tell you the first time I saw guinea worm, and then I'll go on to the end to make my answer brief. The first time I saw guinea worm, Rosa and I went to a little village in Ghana. It had about 500 total population, and 300 of the people had guinea worms coming out of their bodies. It was a horrible affliction that they had known for thousands of years. And I noticed at the end of the open clearing, one beautiful young woman standing there, and I thought she was holding a baby in her arms, so I went over to ask her the name of the baby just to be polite. And when I got close to her, I found out that was her right breast she was holding in her arm. And it was about this long, and a guinea worm was coming out of the nipple of her breast. And I will never forget that moment. Later that year, 11 other guinea worms emerged from different parts of her body. That was our first experience with guinea worm in Ghana. Ghana, this past year, had its last case of guinea worm. They'll never have another one, and that is case now with almost 20 of the countries out of 21. The only place we found guinea worm this year is in southern Sudan. And although we started out with 3.5 million cases, which the film may have shown you, so far this year, in the first 3 years, we've only had 75 cases of guinea worm. So we've cut it down more than 99.9%. And well, I look forward to your next session in Atlanta, which I hope will be back here soon, to tell you about my last case of guinea worm that I've seen. So that's what's going on now with guinea worm, and that's the most exciting thing in our life as far as the Carter Center is concerned, is the approaching demise of the last guinea worm who will ever live on Earth.
That's good news.
That's good news.
Indeed, good news. And Mrs. Carter, what's new with you?
Well, I've worked on mental health issues for 41 years, as you know, as governor. And now I'm working really, really hard to try to get parity, the final implementation regulations for parity. Parity was passed in 2008. And the temporary regulations were passed 2 years ago. It's been 2 years. They have never passed any final implementation regulations. And so what's happening now is that the health management organizations are kind of making up their own rules, which is so bad. And I'm worried, and the mental health community is worried, that the parity bill that has already been passed is never going to be implemented as it should be. The White House says that they're going to include it in the Affordable Care Act, Affordable Care Act. But now they're letting states make some of the rules about what will be done in their states. And so we're really worried about it. I did an op-ed piece with Patrick Kennedy just about a couple of weeks ago about it, and he and Jim Ranstad, who I've worked with for years, Jim in the House and Patrick in the Senate. Well, now they had a press conference when they spoke at the National Press Club, and now they're scheduled to begin. I don't think they've begun them yet, but begin parity. We're developing a parity coalition. They're going to have parity field hearings across the country. I looked to see if Atlanta was on the schedule, but it's not. But to get people concerned, to try to get the implementation regulations passed now. I'm really worried about it. Parity called for employers with 50 employees or more to provide mental health care on call with all other health care. But then the Affordable Care Act, they tell us it's going to cover everything equally. But as I said, now we're worried about what states will do. The states can decide how to implement it.
How then would you define parity? Obviously, people at the state level and at the federal level are looking at the same words. The legislation is the same, and yet if there are variations in how it's defined, it may lead to different consequences. If you were able to say, this is how I define parity, what would be the key elements?
I would say everybody that needs help under the Affordable Care Act, if that's where it's going to be, no matter what kind of help they need, they should get. And Medicaid, one thing about, see, in states, Medicaid pays for most of the mental health care for poor people. And the states determine what Medicaid is going to be.
Well, then what are you concerned about if the state makes a definition and they say, oh, we're providing parity? Have you already seen or heard about interpretations that you don't think mean parity to you?
Well, Florida, one of the healthcare management organizations, canceled all mental health coverage. They did away with that part of their. They said they're going to do another, restart it, but we have no idea what's going to go. What's going on?
It should mean exactly equal treatment for mental health problems and physical health problems under all federal laws.
And that's already passed. That's already passed.
So what do you,
Well,
what do you think should be done?
The White House just has not followed up on it,
No, no.
because it might be politically controversial in an election year, is one reason, if you'll excuse my being frank about it. And we've been waiting now for 3 or 4 years for them just to issue their directives to implement what's already been passed by the Congress, but they have not yet done so.
We're trying to arouse the public to become interested in it and demand that it end up like it's like it was passed, with coverage for everybody.
Is it something that you would advocate legal action? Is this something that they are not interpreting and not following the law as you see it?
Well, we don't know what is going to be in the Affordable Care Act, ACA. We don't know what's going to be in there because they.
In terms of the
right
enabling,
after-
the regulations?
Yeah, right after the speech that at the press club that Kennedy and Ramsey did, the woman from the White House said that there might be a little bit of differences because of the states and their right to determine how the Affordable Care Act would be carried on in their state with different management organizations, different health management organizations.
I think that's it. Yeah, the White House is the one that we're waiting for to interpret the act and to impose the act that the Congress already passed, the parity guarantee. They just haven't done it. And I think it's because it's an election year, they don't want to make anybody angry and lose any votes. But I think that this is one thing that the American news media about health care can pursue, is what is holding up the implementation of the law that's already been passed on giving mental health patients the same treatment as physical health patients.
Well, if you say it's a political calculation, then obviously there are people who think that there are opponents to it out there, that the public maybe isn't aroused about it.
That's exactly right. There are opponents to it, particularly the insurance companies will have
That's
to
right.
pay for it and so forth, but it's really a saving in the long term. But the political consequences of the Republicans opposing the entire Obamacare, so-called, is one of the factors that has deterred the White House, I believe, from going ahead and saying this is a direction that the federal government and state governments have to do pending the full implementation of it.
And if they're included in that ACA, then it's not implemented. If the Republicans do away with it, what's going to happen to parity? It's really frustrating. I have good friends in Washington. Kathleen Sebelius, his father was governor when Jimmy was governor, and I've known her for a long time. Hilda Solis was an intern in Jimmy's office when he was president, but she's the Secretary of Labor. And I have worked with them, and they get me to, and I've called the White House for them, and this one woman from, I guess, HHS, went to, is the person in the White House. They send somebody, and they do priorities, make a list of priorities. Parity is always the priority for the implementation regulations, and it doesn't end up on the list. It's just really frustrating.
Yes, you're in a very elite club here of you've been in the White House.
Yeah, I remember.
Can't you call up President Obama and say, hey, one president to another, what's going on?
I don't think so.
You don't know how many times I've called the White House.
So are they not, I mean, really, what's the reaction? I mean, you're the Carters. They don't take your calls?
They take my wife's calls quickly.
I talked to Michelle about, I'm not sure I talked to her about parity. I've talked to her about mental health and what we're doing, and she's all for it. But then when you try to get the people who are responsible for what's going to happen next, the priorities, you just can't get it. It's mental health.
So is it that they're giving you a very nice answer, being very pleasant, and then you go away and you don't see any action? So does that indicate that once you leave the room, they're saying, oh, well, and making just a political calculation?
Well, I'm not the only one that's been after them about it, but for some reason they want it involved with the Affordable Care Act, and I just have not done it. It's distressing.
And what's going on at the
We
state?
fought really, really hard to get that Parity Act passed. 4 years ago.
What do you think is really at the heart of opposition to parity?
Insurance company, healthcare, management, all that, is that what you call it? Oh, the healthcare programs.
And do you think that, I mean, right now, insurance companies aren't the most popular entities in our country. So if it's a
But
political calculation,
They're not the most popular, but they're the most powerful.
Health and
When it
management,
comes
all
to
that
health
stuff.
care, the insurance companies are extremely powerful, as you know, the lobbyists and so forth. And then, as I said 3 or 4 times, this is an election year, and to lose votes is not popular for either side. And it's a controversial issue. Mental health has always been controversial. And that's what Rosa's devoted 40 years to do, is to try to remove the stigma from mental health problems, so that people will go on an equal basis in their minds and get treated, and also so that insurance companies and others will treat them fairly, but they don't. And that's been a major commitment of Rosa. In fact, if you give her any list of things to talk about, she's going to talk about mental health and parity,
Right.
#1, which is already
We've seen
proven.
that, yes.
When Jimmy was president, I had meetings, my first meetings with the press commission, the press came, and after that, nobody would show up. One day I was walking through the downstairs corridor at the White House and met this woman reporter, and I was asking her, why are you not coming to my press commission on mental health hearings? And she said, well, Mrs. Carter, you'll have to recognize that mental health is not a sexy issue.
what is it still after all these years about mental health when you look at the numbers and you know that everybody either has somebody in their close family, it either affects them, somebody in their family, somebody they know. Even though it seems hidden, I mean, we all have personal experience with it. Why is it still?
I don't understand it. It's the fear factor. What we've learned is that the more people learn, there's a poll done by Columbia University. I work with Columbia a lot, and Indiana University on stigma. And what we learned was that with depression and anxiety disorders, the stigma's going down a little bit. But with the disorders, the serious disorders like schizophrenia, bipolar, the more people learn about them, the more skeptical or afraid they become, because they don't like to know that something's wrong with the brain, and it's the fear factor. And we're trying to learn as much. I worked on stigma for 41 years, and one of the programs at Carter Center is one of our main objects is to work to overcome stigma, and we have mental health journalism fellowships. I think I know that I've been told that there have been many of my journalism fellows in this audience today, and we let them know the facts about mental illness and how to report accurately instead of sensationally like in the past so much, and still some today, but it's gotten better. But I don't know. I don't know how to overcome stigma, and I don't know. I've tried everything. I have been told that the best way to overcome stigma is to learn that, and that person you talk to across the back fence, if anybody still does that, is somebody you know, and you see them, if it's a woman raising a family, a man going to work, and you're not afraid of them, and you learn they're living with bipolar or schizophrenia, then you realize that maybe you ought not to be afraid. But how are we going to do that? We work on it all the time at Carter Center, trying to find different ways to overcome. Mental health fellowships are the best way we've ever had.
What have you seen from that program? What is it that you try? Why involve journalists? Why do you think it's important to involve journalists in this?
Well, I had one journalism fellow from Oregon. He worked for the Oregonian, and this was a good while ago. The year before he had his fellowship, there were 6 articles in the news about no health issues, mostly negative. The year he was a fellow, there were 66 articles mainly positive. I mean, that makes a difference. If you write a story about a person who is living with bipolar and is executive of a company, the head of a radio station, it makes a lot of difference with people. You just need a lot more.
I've got more questions here on mental health, but I don't want to rob your husband of any attention here. So I'm going to just jump right back into things like guinea worm. As you say, it's an affliction that's been around for millennia. It's something that medical science, as you say, had very crude tools to attempt to deal with in the old days, but then there were new tools developed. Tell me about how you decided to become involved in it, and what were the elements that made you believe that this moment in time was the moment when you could actually change something that had been unchanged for all those millennia?
Well, when the Carter Center was founded 30 years ago, approximately, we decided to take on projects that other people didn't want to do. In other words, to fill vacuums in the world. If the United Nations or the United States government or Harvard University or the World Health Organization was taking care of a problem, we didn't want to get involved in it. We just took things that nobody else wanted to address because of the difficulty of the remoteness and so forth. And guinea worm was one of the most difficult challenges that the world ever faced in healthcare, because it only exists in isolated villages, either in the desert or in the jungle, where there's no access to fresh water except a rain pond that fills up maybe 3 months a year, and then you drink water out of the pond for the rest of the 9 months. And that's where the guinea worm eggs develop. So we found this, we just searched the world after I adopted this project to fill a vacuum, and we found this disease in 26,500 villages in 20 different countries in Asia and Africa, and we found 3.5 million cases. So we decided to eradicate it, and we learned how to do it. And we luckily have Centers for Disease Control right next door to us. Mm-hmm. So when a scientist in CDC gets completely infatuated with the disease, but he wants to concentrate on it full time, we steal that scientist from the CDC, bring him to the Carter Center, and put him in charge of the program. So we've had a very good luck there. But now we've decided not only on guinea worm, which is on the verge of being eradicated, but we have 5 other diseases in which the Carter Center is involved. And we don't, and 4 of them are relatively unknown in the United States: schistosomiasis, lymphatic filariasis, onchocerciasis, and trachoma. We also deal with malaria, which is known in the United States but no longer exists here. So the reason that we took on these cases was because neither the Centers for Disease Control nor WHO were making any progress against them. So we decided to undertake that. The Carter Center now has programs in about 73 countries in the world. More than about half of them are in Africa, where most of these diseases take place. And these illnesses that are no longer known in the developed world, even in, say, South America, are prevalent in Africa and afflict hundreds of millions of people. And what grieves me is that we've already proven that the diseases don't need to exist. The people just don't know how to address them, and nobody has cared for them. So that's what we do. Last year, for instance, we treated 11,500,000 people for river blindness, or onchocerciasis, with a free medicine that Merck and Company gives us. We've distributed over 150 million doses of this medicine, which is called Mectizan, and we have to go into the village and actually put it into the people's mouths. You can't send it into a village because people that have river blindness are not only going blind, but they have horrendous itching all over their body, worse than poison ivy. And so if a woman or a man, either one, has a choice of either this one little pill that will ease their problem and prevent blindness, or a diamond of the same age, same size, they'd rather have the pill if they couldn't get the pill. And so we can't just send the medicine in. We have to actually go in and put it in people's mouths. So that's what we do. And trachoma, for instance, is the #1 cause of preventable blindness on Earth. And it afflicts people because eyes get filthy and they get infected, and the upper eyelid turns inward. So every time a person blinks, the eyelashes slash the cornea, and that causes trachoma. blindness. So those are the kind of diseases that we treat. And we have to be the one who goes into the depths of the jungle or into the distant areas of the desert, like in Mali and Burkina Faso and Niger, and actually deliver the medicine and teach the people how to do their own work.
Obviously, these things, the medicine, the science that exists is the same. As you say, the knowledge is there.
Yeah.
The difference in terms of why it doesn't exist in one place or is easily dealt with in one place and yet it becomes an endemic problem in another place, clearly the variable is not medical science. The variable is something else. Tell me about how you learned what to do in order to effectively manage and eradicate these problems in areas where so many people just said, oh, that's just too difficult. We can't do that. We don't know how. What are the right steps, and how did you learn about them?
Well, we're intimately involved with the Gates Foundation, Bill and Melinda Gates Foundation, also with the World Health Organization and with CDC, because the Carter Center has bubbled up to the top of the organizations that actually go and deliver the care and teach people how to care for themselves. So we have been able to accumulate the foremost experts, the medical scientists, who know about these diseases. They come and work for us. And we also get a lot of information from CDC and WHO still. So they tell us what the disease is, and I am an eager student, so is Rosalynn. So we learn all about these diseases enough to go in. But quite often, we go into a country, and since I've been President of the United States, before I get to the country, I can send word to the President of that country. The former President of the United States wants to visit your nation, and he'll say, oh, I want to have a state banquet for you. I said, no, what I want to do is I want to meet with you and your Prime Minister and your Minister of Health and Education and Agriculture and Finance. So I meet with the whole cabinet, and we sign a contract between that country and the Carter Center that we will come in and eradicate or control this particular disease. So I start from the very top level, from the king or president, and then we go out into the villages themselves. And we don't bypass the local, medical cabinet officers as well. So we get to know the country intimately from the capital all the way out to the most remote villages, and that's what the Carter Center does. And so right now we have the only cases of guinea worm left on Earth. We have found 75 cases so far this year, are all in southern Sudan. At this point, at this moment, we have about 8,200 volunteers that we have trained in southern Sudan, and we have about 112 employees, most of whom are southern Sudanese, that are working on this disease, along with our few scientists that we send in from outside. We send in very few foreigners. What we do is go into the country and train those people how to deal with the problem.
We don't send any money to the government. We go in and work with the people and teach them what to do. We teach the health officials. We go into the villages and the health officials in the villages. And it's not hard to find a cure for some things like guinea worm. No medication. You just have to teach them to strain the water so they won't get the egg. And trachoma is building latrines, which keeps the the number of flies down. Jimmy said he's built, we have over 500,000 latrines built in an area in Ethiopia to help prevent trachoma.
I'm more
Jimmy,
famous. I'm the number one
Let's look at the
latrine
sign.
builder on Earth. And so I'm much more famous for that than I am bringing peace between Israel and Egypt. Just building outhouses.
That's what I was going to tell you.
Yeah, I'm sorry.
I have two buttons. One was for the 150 million doses of Mexan, and one got these at the last directors meeting. And the other one is for distributing 10 million bed nets to prevent rheumatoid. And to prevent malaria and lymphatic filariasis, which is coming from the same mosquito.
Yeah. A lot of the health coverage, so-called, in this country and in a lot of developed countries involves doctors in white coats and hospitals and clinics. And yet what you're describing here about both mental health and dealing with some of the diseases you've picked out, you identified a political process.
That's right.
How you get to the leaders, then how you get to the people on the local level. That certainly there's science and medicine involved, but that the real job is political, social, economic. Is that what you're finding?
Well, and the key is journalists in those countries. You know, if the people in this audience, or me 20 years ago, I had never heard of trachoma or lymphatic filariasis or schistosomiasis or onchocerciasis or dracunculiasis. I had never heard of any of those. But when we go into the country and start to eradicate a disease, for them it's life or death. And we don't put our name on things. We let the local people get credit for it. We call it Global 2000. So when a president of a country sees that he no longer has, or she no longer has, trachoma into our country, they can say, my trachoma program, my Global 2000 program got rid of trachoma, got rid of guinea worm. And the same thing with the local village leaders. They can say, our Global 2000 program eliminated this disease. We don't put our name on things. But the fact is that you have to get cooperation from the top leaders without taking credit for it. You have to give them credit for anything that's accomplished in their own people's villages. And that's a key to success.
Yeah, and they do the work.
Absolutely.
They do the work, and it makes so much difference. If people in the village have strained everything and they get rid of guinea worm, it's probably the first time they have ever seen anything successful done in their lives. And you go to those villages, it's just a celebration. It's really emotional.
Tell me
It's
about,
exciting.
when was the last celebration you went to?
What's that? Guinea worm? I don't know. How long have we been? We went to Sudan.
Or-
We went to Sudan for the election.
Okay.
And I didn't go on that trip. Jimmy went way.
Well, just
into
tell
the
me about
jungle.
a favorite time when you went to a celebration. Where was it? What do you remember?
You saw
I
the
went to-
pictures with us with the costumes on.
Uh-huh.
Well, they've given us prime goats, and they've given me grazing rights. They've given me land, frozen land. And want us to come back and put our home there.
They made my chief in one village and put an outfit on him, and then he had to dance around them. And to dance around the crowd.
Tell me, if he ever doesn't do something you want him to do, does he say, hey, I'm the village chief, I don't have to?
That hasn't happened so far.
But you can't imagine the depth of gratitude that these people have to have been, say, 2 years ago, afflicted with, like the little village I mentioned to you, 300 people out of 500 had guinea worm. But if they all do the right thing, then in 1 year, that disease is eliminated. So we went back a year later, they had 0 guinea worm. And that village will never have another case of guinea worm. And neither will Ghana, or neither will Burkina Faso, or neither will other countries that we have been in. So and they remember this, obviously, the older ones. But of course, the young ones will never even have heard of guinea worm.
One of my most exciting visits, and I can't tell this whole story because Jimmy's heard me tell it so much.
But we haven't heard it.
It was the digging a latrine in for trachoma prevention in Ethiopia. And this man who worked with, we have the best people. This one in charge of this came from the Tropical Disease Center in London, Ottoman from the Centers for Disease Control. But he went in and showed them how to dig one latrine. And the woman got so excited. We learned that in that area, whole area, women could not go to the bathroom in the daytime. And I had to go see that woman. So we went to her village. And she's the one that got so excited and got other women in the village. But we just went in and showed them how to do it. And then, of course, we have people that go in and visit them sometimes, but they done the latrines. If they had to pay somebody, it cost about $2, I think, somebody to dig the latrine. But that's the one. We went to see her, we looked in the latrine. They had put sticks over it with palm fronds and leaves, and I was looking in, and they have these big gourds, and they had cut the top out of a gourd, tied a vine to it, and tied it. That was the lid. And she was standing. There was a television camera with us because sometimes if the capital city will send somebody with us. and there was a television camera behind her, and she was telling this man, and now I can relieve myself anytime I want to. It was great. It's great.
It's important.
It's always so exciting to go. I get tired of going to Africa, but
We
and I
thought
say
we might,
next time I won't, but next time I'm right there.
we thought we might do 2,000 or 3,000 latrines that first year. In Ethiopia, we did 59,000 latrines that first year. 89,000.
89,000.
And now we passed 500,000. So that's one of the things we can brag about is how much.
Well, now you talk about the successes you've had in how to work with people in those areas where they need it. Not all eradication programs seem to be sharing all that success. Polio eradication is the end game has been very frustrating, in part because there's been local opposition. There are fears, there's myths, there's political backlash. What's the difference? How is it that what is it that you're succeeding in that perhaps the polio eradication is having trouble with, and would you have advice for them?
No, well, we work very closely with the polio folks, and we're very proud of what they've done, and they've done a good job. But there was one area in northern Nigeria, that's basically an Islamic area, and the word got out that this was a foreign plan to prevent the birth of young, the life of young people who lived in Nigeria, that this was somehow poison. And it was a false report, which has since been corrected even in Nigeria. But that word spread, and that's how polio kind of got its new life. But there are two kinds of polio vaccine, as you know. One is the Salk vaccine, the other one is the Sabine vaccine. And the Sabine vaccine is very simple. You just put 3 drops on a baby's tongue, a young people's tongue. But there are 3 kinds of polio. This is kind of complicated. And some of the vaccines of the number 2 kind, the 3 kinds, cause polio to happen in one case in about 2 million. But when you immunize, several 100 million people, you have maybe 50 or 60 or 70 that get polio. So that's what they're dealing with now. In the latest edition of Scientific American, there's a complete report on this, if you really are interested in it. But that's what's happened. It's not a matter of not dealing with people properly, which we try to do, or that the polio folks did not treat them properly. They were just afflicted with bad luck.
Mm-hmm.
And also, I think one thing we do is we let the people do the work, and that's one thing that's a little bit different, I think.
And we learn from each other. We cooperate with the polio folks, they cooperate with us.
Yeah. And how much, obviously, that you see the patterns and you see that where there's social disruption, where institutions don't work, that's where you see disease.
Well, that's a problem, and that's why we still have guinea worm in South Sudan, is because Sudan and South Sudan have been at war for 30 years. You've been over there. And so we went over, Rosa and I went over in 1995. We couldn't get into southern Sudan at all, and we knew they had a lot of guinea worm, not how much. So we finally negotiated a peace agreement between North and South Sudan after 25 years of uninterrupted war, just for 6 months. So we could go into southern Sudan and analyze the guinea worm problem. And we found a lot of guinea worm there. And then the war started again. And we couldn't get in and give them our bed nets to strain the water through, nets to strain the water through. But the Tuaregs in the northern part of the Sahara Desert developed a system where they tied one of our little screens on the end of a reed, and they would take it around on their necks because they were nomads. And they would use that little reed with a net around the bottom to suck water through and take out the guinea worm eggs. So we found out about it, and the Norwegians made 9 million of those strainers, filter tubes, and we sent them into southern Sudan, although we couldn't go in. So by the time we finally got into southern Sudan, they had cut down guinea worm a lot. So we have to work with, scientific elements and also with a lot of other people to cooperate.
And also another thing is the last stages of something, like polio, like guinea worm, are difficult.
Mm-hmm.
If it's not all gone, it's because of something in the village, like the chief doesn't approve. In Sudan, there we have people attacking overrunning our offices and destroying everything, and because of the war. So the last stages, and also you have to monitor every country, it takes 3 years. You have to be, a country has to be without the illness 3 years before the World Health Organization will declare it free of what do they call it? It's not eradicated, it's eliminated before they will declare it eliminated. And so you have to monitor it closely. And I think it was Ethiopia where this man came in after they've gone from Ethiopia, except 1 or 2 cases, and somebody came in and went down a river and stopped it along and gave guinea worm to different people after it had been gone from that area. And then also recently in Chad, which has been gone for 10 years and a few cases. So you have to have monitors everywhere. It's really expensive, the last stages of a disease.
Yeah. Another parallel, I think, between some of what we've been talking about in mental health and some of these physical health problems in the developing world have to do with who cares, who's paying attention, and telling the stories. We're all journalists here, we're storytellers. And when we go into our editors and bosses and say, hey, I've got this story, and that you run into on a mental health story or on a story about a guinea worm or something else that's happening far away from the circulation area of that paper or coverage area of that TV station, there's like, well, why should our audience care? Why should they care?
But I think the average American person reacts positively to a success story, particularly in Africa. And for instance, Nicholas Kristof from the New York Times has been with us to the most remote areas of Ethiopia and sometimes in southern Sudan. And he writes articles in the New York Times, which carries around. But I think any single journalist, any of them here, can write a favorable story about our success or other success in getting rid of a disease, even in a foreign country, and it comes home to the readers in Atlanta or in St. Louis or in Los Angeles or wherever. So I think that's one thing that can appeal to people is the plight of people who suffer, and then later they don't suffer anymore because of assistance to them, but also because of their own initiative and their own capabilities and dedication.
And yet on mental health, you're saying that you just keep running into the same stigma issues, the same unwillingness to open it up, and resistance to discussing it that you've seen for 4 decades. How do journalists get through that?
This is your chance.
I think that just writing stories about what's happening, and if there's something sensational that happens, like shooting of somebody in the Capitol in Washington once, I think, and it's really good to go back and see, almost without exception, it was somebody who did not get the mental health care he or she needed, almost without exception.
And you have to remember that Walter Cronkite's daughter suffered from depression. Mike Wallace, who just died, suffered from depression. Abraham Lincoln suffered from depression. And one of the Rosalynn journalists wrote a whole book about Abraham Lincoln suffering from depression. And the fact that famous and successful people do suffer from mental illness and succeed is a very good story always. And there would be people in every community represented here of a chief executive officer of a major corporation who has suffered from depression. And increasingly, those top leaders are willing to speak out primarily because of Rosalynn's influence, by encouraging them to do so and how they can be very beneficial to other people just by speaking out.
But also, today, because of what we know about the brain now, people recover, people can recover, even from serious mental illnesses. And everybody doesn't know that. I think if people learn that you can recover, they would be more willing to get help. Recovery is possible. There will always be a few that can't recover, but I have known so many people with schizophrenia, bipolar, now who are running businesses, leading normal lives, raising families, and those kinds of stories need to be out there so people will know and can go and get help. People don't go to get help because of the stigma. In some way, we've got to get over the stigma. And I think if people, well, a journalist that I'm so proud of, most of them have kept on writing stories. I got gotten involved with mental health issues, and I'm still writing stories. They're influencing people in the newsrooms, I think the more that we learn and hear about, or write stories about people who are in big positions or raising families and going to work every day, those kinds of things. We're now working toward the mental health treatment is changing. We used, when somebody went to a doctor and was diagnosed with a mental illness, all hope was gone because I didn't think anybody could recover. Nobody thought anybody could recover back even when we had the President's Commission on Mental Health. But now if people knew that and knew that they could look forward to it, they would be more likely to go for help. If they could see people, and another thing it's moving toward recovery, but it's also moving toward integration, they call it, private care, private doctors and mental health community working together, like a community center where you can get any kind of treatment that you need. And if they had them in the communities, and people could see those with mental illnesses going in just when they have an episode and need help, and other times living in the community, raising the children, going to work, I think that would do more to overcome stigma than anything, but we got to get that out there, and get people over the fear factor.
Yeah. Now, during the years, President Carter, when you were governor and then president, back in those decades was the time of transition from predominantly institutionalized care, the one flew over the cuckoo's nest days,
Sure.
to working towards community-based management and treatment of mental health. There are a lot of people who say that didn't end up doing so well because those people got pushed out of institutions and ended up on the streets.
That's true. As a matter of fact, the first movie we saw in the White House was One Flew Over the Cuckoo's Nest. So you're right with your historical memory. Thank you. Congratulations on that. And I had a meeting earlier today with journalism class at Emory. Both Rose and I are professors at Emory University. And Jack Nelson was mentioned, who got the Pulitzer Prize. He was a LA Times representative in Washington and won the Pulitzer Prize here for his revelation of the abuses of mental health patients within the great institutions, like in Georgia. We had 12,000 patients crammed in there for a lifetime and treated like animals. And it was that revelation that finally opened up the mental health opportunities for people to go into the community centers. There's still a lot of need, but at least Rosalynn and her cohorts, including former Senator Ted Kennedy and his son and others, have really done a lot to open up the opportunity for people to know about mental health. So this is changing slowly. I think stigma is being removed a lot more rapidly than Rosalynn will acknowledge, because it's still an uncompleted task. But there's a lot of knowledge now that hasn't been forthcoming in the past.
But how about the specific criticism that closing down, a lot of state mental institutions were just shut and people were moved out, and perhaps the safety net wasn't there to pick them up in the community?
No, but it's better to have some, I think, homeless than to have 12,000 in a place where there should be 3,000. Where they had nothing to, they didn't wear clothes, it was awful. And that was what happening. The big expose of our Central State Hospital by Jack Nelson. Just in 1958 or something, Jimmy was running for governor in 1966, and I was campaigning. Community Mental Health Centers Act had been passed, but no centers had been built yet in our state. But they were turning people out with no whip. That's when I got involved, because people were asking me every day I was campaigning what my husband would do for a loved one at Central State. Well, Georgia is on the way to have a good mental health program, and it's because of Andy Miller, who is here, I saw him earlier, and his cohort, who did a big expose of our mental health hospitals. Found 130-something people who died unnecessarily, things they could have gotten over. And We had court, went to court with state, with 2 suits against it, and we got a good settlement, and now Georgia is, and while the settlement was going on, the Carter Mental Health Program decided, we worked with the advocates in that settlement. We decided to develop a vision of a really good mental health program. So we developed it. And now, and the state began working with us. We were working with them, with some of the advocates, and started working with the state when we're trying to get the settlement. And now we're having hearings across the country. The settlement came down requiring community services for those who needed it. Anyway, we got an increase in our budget, which nobody else in the country did, I think. But there's hope now for other states to have a better system because of the settlement we got, because they're all under at least one of those suits about a law that was passed many years ago that's never been implemented.
We have just a few minutes left. I've got a list of questions that were submitted by our members, and I'm afraid we've had so much fun talking, we're not going to get to all of them, but several of them get to one of the key policy questions facing the nation right now. What is the Supreme Court, and what is Congress, and what might the next president, whoever that is, do about the Affordable Care Act and next steps, if there are any, in health care reform? What's your view of the things happening right now in this country about our system of financing and delivering health care?
Well, I think the most important single fact to remember is that we have 31 million people in America that don't have health insurance coverage. And that applies to some of our children as well. And it's a devastating thing for any family to be faced with a major illness, mental or physical illness, without any money to pay for care. And so this is, I think, the major reason that I and other presidents since me and even before me have tried to get comprehensive health care. And I'm very glad that President Obama made that attempt, although I was very disappointed at the outcome of the legislation. It's still a big improvement in the future. If Obama is reelected, then obviously the federal government will continue to try to implement it. And if the Supreme Court should rule otherwise, then I think we'll have to go back to scratch and see what we can do. But the United States spends much more than any other country on health care, and ours is much inferior in general terms to that in Canada or Great Britain or France or other European countries. So we have a long way to go in health care, and I don't yet know what's going to happen. Knowing what the Supreme Court, this particular Supreme Court has done in previous rulings, I don't have much confidence that they'll make a right judgment.
What do you think would happen politically if either the Supreme Court nullifies the entire law, or for whatever reason there's a change in the White House and Congress and they vote to eliminate the law?
I don't know about politically, but I think the more pertinent question is what will happen to the people that don't have health coverage. They will suffer. So we'll have a lot of millions of people in our country that will suffer because of that adverse decision that's made either by the next president of Congress or by the Supreme Court.
And yet there seem to be polls and other things say there's a lot of opposition to the law.
I know.
What's going on?
I don't know what's going on. I'm not in charge anymore. But I think there's been a lot of, I would say, propaganda that's been put out about, about death knell for old people and things of that kind. Rosa and I come into that category, by the way. We soon have been married 66 years, and we're still trying to get along with each other successfully. But I think that the Tea Party group and some of the Republican candidates have all been very successful through Fox television and others, some radio talk shows that I won't mention in a public crowd, that they've misled the American people. Because I think if the facts were known, then I believe the American people would say we need to do something to improve our health system, and I think comprehensive coverage is better. I would personally have preferred what they call a single pay plan, which have been much simpler. And that's what President Obama promised during his campaign, but later under political pressures, which I understand he had to change his position. But that would have meant just taking what Medicare does now and expanding it step by step to include all age groups and not just apply to old people. So Medicare, if expanded, could have been a very simple and comprehensive program.
Well, we're just one more question here that came from the list submitted by our members, and it was a perfect segue from something you just said there about not being in the White House anymore. Will you run again?
No, I think there's an age limit.
Well, thank you again very much, President Carter and Mrs. Carter. We truly appreciate your time.